Hi, I'm Jackie Van Mieghem with my husband Dennis Van Mieghem, and we came to the Institute because I had a diagnosis of cancer as a reoccurrence. I had a hysterectomy 2 years ago. It'll be 2 years ago in January, and in that hysterectomy, in the uterus was a sarcoma, and I was told. And then also I had breast cancer at the same time. And they were not connected or related, whatever. It was just two individual cancers. And I was told that if the sarcoma came back, that it was more or less curtains, that there was nothing that could be done. But in November of 2011, I had a double mastectomy and a reconstruction from my own stomach tissue. And then in February, I went to the emergency room because of extreme reflux problems that had kept me up all night. And it was determined that I had a tumor impinging on the small intestines that just let out from the large intestine. So the doctors suggested I go to hospice, and I wasn't ready for that. And as we had heard about the Institute here, we came here instead. I did not tell my doctors what I was doing because I felt like they, as they had the year before, say, no supplements, you just keep, no changes, just do what we tell you. And so I felt like I didn't have time to wait for their approval. I came, and it seems to be working very well. The Institute had been recommended by a friend of our daughter's, Beth Smith. She had been through the Institute in trying to conceive, and she was very successful with their diet and program. She has 3 children now. And so for health reasons, I'm here, and it was a very good decision that we made. And it was a family decision, and then that has worked well. The diet shed about 60 pounds, which was good. Dr. Nemec says we need no body fat, and I haven't reached that goal yet, but I do feel much better, and of course had to get a new wardrobe. Dr. Nemec says we look at this food as medicine to cure our body, to make it inhospitable to cancer. And the last 2 CAT scans that I've had have shown that the tumor is gone. So things are going well. I feel much better. This past month has been a more normal, probably the most normal month I've had in a year. And I would recommend this program because in watching videos and listening to Dr. Nemec, we need to eat differently, and we need the supplements. I do feel good. The body operates well, and I'm to more normal function than I have been in a year. I have recommended this program to friends, and a couple are presently upstairs now doing it, and there was no diagnosis of cancer, but she just didn't feel well, and they kept giving, due to ear infections, giving her antibiotics, and one thing led to another, and she called me after a friend told her what I was doing, and just inquired, and then came out. So it has enhanced their lives as it has mine, and my husband and family have been very supportive in all this, and I can't imagine that I would have succeeded without their help. It's an involved process, but it does seem to be working its wonders. I would just encourage anybody, listen to the videos and make healthy changes in your diet. Was talking with a friend whose grandson has severe food allergies, and they live in Australia, but they'll be coming in this summer, and even by email they can probably inquire as to the diet, but so they've started talking in that respect.
Just pleased that you're a lot better now than before you started this program. So we have hope now that you're going to be around for many years.
The doctors are amazed. The oncologist and the surgeon, they had suggested I go with hospice last February, and I knew I didn't feel like going with hospice. That would be basically not seeking any further treatment. But I was a patient care volunteer for 20 years, and I thought, I don't feel like what my patients seem to feel like when they were with hospice. So we came here instead. I hope this is a help, and I can only encourage you to try, and it's worth the try. The diet or the food that we're eating, I don't feel cluttered. It is cleansing, I guess, and the body functions. My energy level continues to to improve, and I have put on some weight, and the oncologist felt, well, it's due to quite possibly due to the fact that my body is absorbing, which is fantastic news. And they're surprised I'm off of the feeding tube that I've been off of since March. If I weren't coming here, I would sorely miss it.
She looks much like she does now, like when we were dating. So the fact that she has a lot of energy and a positive mental attitude, and there's hope. And that part is extremely important because before she came here, I was crying a lot because neither of us had a lot of hope, and hope is there now, and hopefully she will be around for years to come, and we can enjoy our next 20 years together. By the way, it's been 49 years almost. We've been married, and hope to see her 50th and 60th in the coming years.
I think after being through this diet change and the information that you gather here, we all need to be eating differently, and supplements are very important, but especially if you have a challenge, if you have any disease.
I've been pleased with everything, and I would say too, probably one thing that's important but sometimes hard to do is get that stress level down. She's been doing a good job of it. She doesn't even pick on me anymore. That's a lack of stress on her part, right? Right.
Try not to. Yes, as I would say to Dennis during times this past year when the blood levels were really down and I was laying on the couch all the time, I want some enthusiasm, and that seems to have come back.
I would mention one other thing too. We've she must be on 100 prayer lists too, and you never know, just what that part is doing, but we believe it really has helped. And as I say, there's just so many of our friends, relatives, and what have you. They've got her in their prayers every day.
Oh, and I thank people for their prayers tremendously.